Hello everyone. In this video, I will be discussing a COVID-19 medication, PAXLOVID, Nirmatrelvir and Ritonavir, which was initially approved by the US FDA in May 2023 for the treatment for mild to moderate COVID-19 in adults with high risk for progression to severe COVID-19, including hospitalization or death. Now, let's dive into this medication in more detail. Nirmatrelvir and Ritonavir, brand name PAXLOVID. This medication was initially approved by the US FDA on May 25, 2023, and indicated for the treatment for mild to moderate COVID-19 in adults with high risk for progression to severe COVID-19, including hospitalization or death. Chemically, PAXLOVID is a combination therapy of Nirmatrelvir and Ritonavir. Nirmatrelvir is an oral small molecule antiviral peptidomimetic, which is shown in red. The molecular weight 499.53 gram per mole. Hydrogen bond acceptor 9. Hydrogen bond acceptor refers to the number of nitrogen and oxygen within the drug molecule. Hydrogen bond donor 3. Hydrogen bond donor refers to the number of OH and NH groups within the drug molecule. Log P 0.9, which is a lipophilicity parameter for the drug molecule. The higher log P, the more lipophilic drug molecule. Polar surface area 131 square angstrom. In contrast, Ritonavir is an oral small molecule, which functions as a PK enhancer, is shown in blue. Molecular weight 720.95 gram per mole. Hydrogen bond acceptor 11. Hydrogen bond donor 4. Log P 5.28. Polar surface area 202 square angstrom. This medication is available as tablets. The strength of the tablets is 150 mg for active pharmaceutical ingredients Nirmatrelvir and 100 mg for Ritonavir. Recommended dosage 300 mg Nirmatrelvir, which is 2 150 mg tablets, and 100 mg Ritonavir, which is 1 100 mg tablet, with all 3 tablets taken orally at approximately the same time each day, twice daily for 5 days, with or without food. For patients with moderate renal impairment, estimated glomerular filtration rate, for short eGFR, greater than or equal to 30 to less than 60 ml per minute. Lower the dose to 150 mg Nirmatrelvir, which is 150 mg tablets, with 100 mg Ritonavir, which is 100 mg tablets, with all 2 tablets twice daily for 5 days. For patients with severe renal impairment with eGFR less than 30 ml per minute, including those requiring hemodialysis, lower the dose and the dose frequency. Specifically, on day 1, 300 mg Nirmatrelvir, 2 150 mg tablets, with 100 mg Ritonavir, 100 mg tablets once. On days 2 to 5, 150 mg Nirmatrelvir, 150 mg tablets, with 100 mg Ritonavir, 100 mg tablets once daily. Further, ensure to initiate PAXLOVID treatment as soon as possible after diagnosis of COVID-19 and within 5 days of symptom onset. This medication also carries a US box warning, significant drug interactions with PAXLOVID. Mechanistically, this medication works as an inhibitor of the SARS-CoV-2 main protease, MPRO, with a Kr value of 3.1 nanomolar and RC50 value of 19.2 nanomolar. AMPRO is also referred to as a 3C-like proteins, 3C-ALPRO, or non-structural protein 5, NSP5 proteins, subsequently blocking processing the viral polyproteins PP1A, PP1AB, and preventing viral replication. In addition, the X-ray co-crystal structure revealed that Nirmatrelvir bound directly to the active site of SARS-CoV-2 AMPRO enzyme target. Notably, Ritonavir, a HRV protease inhibitor, but is not active against the SARS-CoV-2 AMPRO. Within this drug product, Ritonavir functions as a PK enhancer by blocking the CYP3A-mediated metabolism of Nirmatrelvir, therefore leading to increased drug exposure for Nirmatrelvir. Pharmacokinetically, Tmax, the median time to reach the maximal plasma concentration for Nirmatrelvir and Ritonavir, is 3 hours and 3.98 hours respectively. With regard to food effects, in healthy subjects, there wasn't a significant difference in Nirmatrelvir and Ritonavir exposure after taking a high-fat, high-calorie meal. Therefore, this medication can be taken with or without food. Protein binding 69% for Nirmatrelvir and 98 to 99% for Ritonavir. The apparent volume of distribution VZ over F is 104.7 liters for Nirmatrelvir and 112.4 liters for Ritonavir. Metabolism. Both Nirmatrelvir and Ritonavir are primarily metabolized by the CYP3A enzyme, and CYP2D6 also plays a minor role in Ritonavir's metabolism. However, in the presence of Ritonavir, a strong CYP3A inhibitor, Nirmatrelvir is minimally metabolized. The mean half-life of Nirmatrelvir and Ritonavir is approximately 6.05 and 6.15 hours respectively. Excretion. Nirmatrelvir is mainly eliminated renally, and Ritonavir is primarily metabolized in the liver. In the urine, for Nirmatrelvir, 49.6%, but approximately 55% as a parent drug molecule, and for Ritonavir, 11.3%, but 3.5% as the parent drug molecule. In the feces, for Nirmatrelvir, 35.3%, but 27.5% as the parent drug molecule. For Ritonavir, 86.4%, with 33.8% as the parent drug molecule. Drug-drug interactions. Given Ritonavir is a strong CYP3A inhibitor and an inhibitor of CYP2D6, P-glycoprotein (PGP), and organic A9 transporter polypeptide 1B1, OATP 1B1, co-administration of PAXLOVID can increase the drug exposure for other drugs. For example, certain CYP3A and 2D6, PGP or OATP 1B1 substrates, which can lead to increased adverse effects, including serious and/or life-threatening reactions. Also, as mentioned, Nirmatrelvir and Ritonavir is primarily metabolized by the CYP3A enzyme. Other drugs, for example, strong and moderate CYP3A inducers, can decrease the drug exposure for PAXLOVID, which can lead to decreased therapeutic effects and the potential loss of virological response. Taken together, carefully evaluate the drug-drug interaction potential prior to and during PAXLOVID use, and review other concomitant medications as well. Contraindications per PAXLOVID prescribing information. History of clinically significant hypersensitivity reactions to the active ingredients, Nirmatrelvir or Ritonavir, or any other components. Co-administration with drugs highly dependent on CYP3A for clearance, and for which elevated concentrations are associated with serious and/or life-threatening reactions. Co-administration with potent CYP3A inducers, where significantly reduced Nirmatrelvir or Ritonavir plasma concentrations may be associated with the potential for loss of virologic response and possible resistance. The most common adverse reactions greater than or equal to 1% associated with the PAXLOVID include dysgeusia, which is a taste disturbance and dysfunction of the sense of taste, and diarrhea. Here are the key sources which I have used to prepare for today's video. Most of the medication information which I share today is based on PAXLOVID prescribing information. This document is available at the US FDA drug website, along with the drug manufacturer websites. Finally, I want to thank you so much for watching. If you find this video helpful, subscribe for future medication video updates. As always, keep learning and elevating. Thank you so much.